Hi and welcome to today's video. Today we're going to talk about the purpose of pain. As we saw in one of my last presentations, we know now that there is probably in most of the cases a purpose for pain. So if the pain is chronic, that means that the injury or the illness is already 3 to 6 months in the past and you're still having pain, which is defined as chronic pain, as we learned, then it is very likely in most of the cases, as we see, that there is something behind the pain. And the pain is staying or not leaving because the pain thinks that he has a purpose. And oftentimes it is the case, and this is actually most of the time from the early childhood, or it could also be from earlier life situations. Let's take a closer look. So the main three parts that I would define the purpose of pain could be punishment, protection, and prioritization. So the pain can punish, protect, and prioritize. We have some examples here. In this case, let's call the lady Anna. Let's say Anna is in her 70s and she is experiencing heavy back pain, especially before she is visiting her family. This is a quite normal situation, I would say, in many people's life, unfortunately. And then when we look at the childhood, there was something happening when Anna was 5 years old, as we see in this example. So Anna was asked by her mother to watch her baby brother Brian, look after him and take care of Brian. And in a quiet minute when Anna forgot to watch Brian, Brian was running out on the street and unfortunately hit by a car. And the accident was so severe that they had to take off Brian's leg, and everybody blamed Anna. Of course, her mother said, "Why didn't you watch him? I told you so," and so on. And this is actually now the reason why she is punishing herself, because she still has the feeling she has done something wrong and she is punishing herself. So this is a very clear pattern. And it even gets more clear if we know that the pain is getting much more severe when it's connected to some similar feeling or to the visit of the family. In the next case, we are looking at protection. So the pain can protect you. This could be as simple as you need to hold a presentation or you need to do something special at work or in school or whatever, and suddenly you get a heavy migraine or back pain or whatever. So your body is trying to move you away from this situation, tries to keep you away from the situation by doing all that things. So it's really powerful. A more precise example would be, for example, imagine that your parents or somebody's parents are fighting and the child is there and the child doesn't know what to do, of course, because as a child, you don't have the tools to stop the parents, for example, fighting. So what happens a lot of times, even children can develop migraines or some skin issues or even other issues like asthma. And in this case, let's say this girl is developing a migraine because the purpose of it is to make the parents stop fighting and take away the attention from the fight to herself. So this is working for her, or this used to work for her when she was young, and it really had a purpose then. But now in situations where it gets a little complicated in your relationships or with people, just in work situations, and when there is certain conflicts or situations getting a little complicated. Suddenly she's also experiencing migraines. And this is because her body remembered that this worked in the past. So the body is trying to use this tool again to protect her in all the situations now. I think it's pretty clear with these examples. There's a second example. Let's say this girl also, a similar situation. The parents are fighting all the time and she doesn't feel loved in the family. Or it could even be a better example that there is a newborn baby and the child, which is not newborn, is having the feeling or getting the feeling that the child is not loved that much anymore because all the attention is on the baby and everybody's taking care of the baby and it's just the baby. And now it could be possible that this child is developing asthma or some skin problems. Because of the skin problems, the parents are focusing more on the child again, and maybe they take time to drive with the child to the doctor, they put on cream on the skin, and they really take time again. So this works again as tool to get the attention back from the parents. And yeah, it's very clear to see what's going on. And then a really interesting one is also to prioritize. So how does that work? For example, just imagine like a family situation. It often happens with if you have brothers and sisters. So one of the children oftentimes will take the part of being the sick one because he's getting attention through being sick. And one of the children may take the part of being the achiever, so doing everything great all the time. One will be the caretaker and so on. But there's also a part left to be like the sick one, basically. And this actually will draw the attention, of course, to this child because the child needs to be taken care of. And this, of course, can also be developed in a later stage. So, for example, if you are, you don't feel loved, you don't think that you have something special or whatever, then oftentimes it's also an opportunity to stand out and to stand out in a way that everybody will treat you in a better way because they know that you're sick or they know you need help and so on. So this is also something that works pretty well, that the pain knows that this works pretty well. And also in this case, oftentimes it happened in childhood or in early life, and often it comes back, this pattern comes back because somehow it got stuck in our unconscious mind, or the body can remember, or the unconscious mind can remember that this worked in the past, and we'll bring it back to situations. So I hope that was useful. This was the purpose of the pain, which I find very interesting and very fascinating. And oftentimes to help people, to help our clients, what we do is we take them back into the scenes from the childhood to discover that. And then we make them realize that they don't need that anymore. And there's also more techniques that we're teaching in our pain relief method, as you will see in later presentations. So there's a lot of ways we can also talk to the pain and just sit and do some mindfulness work. It's very fascinating, the results we can achieve through that. So I hope that was interesting for you, and I'll see you in one of the next presentations. Take care. All the best. Bye-bye.